So in today's session, we are going to study about respiratory infections, not from the textbook. Today's sessions are not from the textbook. So respiratory infection. What is a respiratory infection? A respiratory tract infection affects the respiratory system. That's a part of your body which is responsible for breathing. Okay. And it has various organs, okay, parts. We divide the respiratory system into two areas: upper respiratory infections or upper respiratory system and lower respiratory system. Okay, so up till your throat, it's the upper respiratory system, up till your voice box. Okay, and below that, the trachea and everything, lungs, trachea, they all come under the lower respiratory tract system. Okay, so your nose, nostril, larynx, pharynx. Okay, when you open the mouth, you see the end of your mouth. That area is the pharynx. Okay, that hollow area is the pharynx. Okay? Below that is larynx. Larynx is called the voice box. Okay, so below the larynx, below the throat. Okay, larynx is what we call as the throat. Okay, below the throat, it is the lower respiratory tract. So what is an upper respiratory tract infection? So usually it affects the sinuses and throat. Okay, whatever infections stay up till these areas that affect your sinuses. Sinuses are the hollow in your skull. Okay, on both the sides of your nose, near your eyebrows. Okay, you have sinuses. These are hollow areas in your skull bone. These are hollow areas. Okay, they are only supposed to be filled with air. Okay, and when the sinus is filled with air, you don't feel the weight of your skull. Okay, you don't feel the weight of your skull bone. It's because these hollow areas are filled with air. Okay, when they get filled with mucus and other fluid, that is when you feel that stuffiness and heaviness when you get respiratory infections. Okay, you feel the heaviness of your head. It's because of your sinuses are filled with fluid instead of air. Okay, so your common cold, epiglottitis, laryngitis, pharyngitis, that is the sore throat that you have, sinusitis, these all are common infections that affect the upper respiratory tract. Cough, fever, stuffy nose. So what are lower respiratory tract infections? That affect your airways and lungs in general. Okay, and they last longer and they're more serious. Okay, because whatever respiratory infections that happen in the lungs, okay, mucus is secreted. This mucus has to get out of all these small branches and they have to travel upwards into the trachea, and even from the trachea they have to reach the larynx and pharynx. Okay, and then you cough it up and you can spit it out. Okay, so treating lower respiratory tract infection is much more tedious. It takes more time. Okay, if you have any lower respiratory tract infection like pneumonia, it will take longer for you to recover as compared to common cold. If you have common cold, hardly 1 or 2 days you will suffer through it. Okay, but if it is pneumonia, it may take a week or more to completely cure out of it. Bronchitis as well, inflammation of the bronchi. Okay, bronchiolitis, these small branches that you see, these small networks, these are the bronchioles. Okay, bronchi, we have two major bronchi. Okay, this is the trachea. This one straight line is trachea, and the trachea divides into bronchi. Okay, right and left. So bronchitis is inflammation in this major trunk area. Bronchioles are these small branches. Okay, when there is inflammation in these small branches, it's bronchiolitis. Okay, usually affects young children. Usually young children are more prone to getting pneumonia and lower respiratory tract infection, chest infections. And these are the alveoli. Alveoli are the airbags of your lungs. Okay. These small bronchioles, they end into alveoli. Okay. These are the bronchioles that end into alveoli. Alveoli should not be filled with fluid. Alveoli is the airbags. Okay. But during infection or inflammation, they get filled with fluid. And this fluid has to be expelled into the bronchioles. From the bronchioles, they have to go into the bronchi, from bronchi to trachea, and so on. It has to be spit out. Okay. So that's the mechanism. That's the reason why it takes longer for you to cure from lower respiratory tract infection. Is it clear so far? So what causes, see, asthma is a situation in which your bronchi, it squeezes so much because it has swollen up. Your bronchi and your throat has swollen up. Okay. That there is not much space for the air to pass into the lungs or air to come out of the lungs. Okay. That is asthma. Wheezing, it's WHEEZING. That is wheezing. Wheezing is that sound. Okay. If you know how an asthmatic person breathes, it has a shrill noise to it. Okay, that is wheezing. And that shrill noise is an indicator that the bronchi, the trachea bronchi, okay, these are inflamed and it is swollen up. There is not enough air passage. So wheezing is the sound. Okay, wheezing is, we call it wheezing, means it is a sound in that shrill voice while you breathe. Okay, that's a difference. So what causes upper respiratory tract infection? When any bacteria or any pathogen, bacteria or virus that enters your respiratory system. Okay, even if you even if it is an direct contact or indirect contact. Okay, when germs enter your body through hands, or even if you touch certain areas or you are using certain articles used by a sick person, okay, who is suffering from so and so conditions. Okay, and if you use those, you use the same utensils, use the same towels, okay, or exchange clothes with the sick person, use the same bed linens. Okay, so this bacteria can affect you as well. So this is indirect contact or direct contact, or you may breathe in. You may breathe in the droplets from their cough or sneeze. Okay, when you are around a sick person who has a respiratory infection, the surrounding area, okay, depending on what kind of respiratory infection they're suffering from, there is airborne and droplet. Okay, airborne, you should not be with them in the same room. Okay, droplet, you should not be near them, just keep a 1 meter, 1.5 meter distance. That's enough. Okay, you can be in the same room, but keep 1.5 distance. Okay, that is droplet mode of transmission. Okay, so in this way, upper respiratory tract infection can transmit from one person to another. Okay, it could be viral, bacterial, fungal, allergies, nasal polyps. Okay, deviated nasal septum. Nasal septum is that mid portion of your nose that divides your nose into right and left nostril. Okay, some people have a deviated nasal septum. It is not in the middle. Okay, it is turning to either one of the side. Either it is it's in some people, just you look at their face, you can identify the person has a deviated nasal septum because the nose is turned to one side. Okay, otherwise if you just press your nasal septum, okay, you can slightly press your nasal septum and see uh, which side your nasal septum is moving. Okay, if it is not moving to any side, it is being pressed down, you don't have any deviated nasal septum. But when you try to press the middle part of your nose, and if it, you can see that the nasal septum, the mid of the nose is either going right or left, it means you have a deviated nasal septum. Usually people who have polyps, nasal polyps, they tend to have deviated nasal septum. Okay, what is nasal polyps? Majority of more than 50% of the population has it, especially if you have dust allergy or any respiratory allergies you suffer from childhood. There are high chances, 99% of chances, that you may have developed a nasal polyps. Okay, if you look into the mirror, take a flashlight and look into the mirror on your right nostril, majority of the nasal polyps take place on in your right nostril. Okay, take a flashlight and look into the mirror and just turn your face up to visualize the inside of your nostril. Okay, you will see a pink mass, that is nasal polyps. Okay, usually you don't require any treatment for it. Okay, in very rare cases, very rare cases, nasal polyps can cause distress in breathing. Okay, and when you are undergoing an allergic episode, okay, right now you are exposed to some dust and you're allergic to dust, for example, and right now you are sneezing, coughing, everything is itching. Okay, you will see that your nasal polyps may have swollen up. Okay, nose bleeding is usually common in children who are dehydrated. Okay, so who is at risk of upper respiratory tract infection? Anyone can catch it. Okay, like for common cold, anyone can catch common cold. Children, but are at the highest risk because they may often play with other group of children who are carrying certain virus and bacteria. Keeping children clean always is difficult. Okay, they uh, lot around in the mud. Okay, and they don't wash their hands, they don't drink enough fluids, they don't have enough fruits as well. Okay, and people who have heart and lung problems from childhood, they are also at a higher risk of infections. People who have weak immune system, either they're suffering from other disease condition, or they have some autoimmune disease conditions, or they are on immunosuppressant drugs. Okay, so the immunity is weakened, so they are at the risk of upper respiratory tract infections. So how do you diagnose it? You just do a physical examination. Okay, you tell out your symptom to the physician. They will take a look into your nose, ear, throat to see if it is inflamed. Okay, and they will hear your breathing using the stethoscope. They will examine your chest to see if there is any mucus blockages in your breathing or not. Okay, usually other tests are not required. This is enough. Okay, but if there is a lung infection, okay, if the physician is doubting some lung infection like tuberculosis and all, in that case chest x-ray will be recommended, CT scan, pulmonary function test is done to see how your lungs are functioning. Usually people who are asthmatic, who suffer from pneumonia or asthma, bronchitis, okay, for them PFT is done to see what is the capacity of their lungs. Okay, nasal swab test, throat swab, this is done to see which exactly what is causing you an infection. Okay, is it a bacterial infection or a viral infection? To find out who is the causative agent, what pathogen we are dealing with. Okay, to find it out, we do the nasal swab and throat swab. Okay, swabs, if you know how the during corona COVID lockdowns, okay, whenever you have to go somewhere, how you have to give the nasal swab test. Okay, so that is the, they poke a bud, a long bud into your, a swab into your nose. Okay, it is done from the throat as well. Sputum test, the mucus that you cough out. Okay, that is collected in a sputum container, the phlegm. Okay, and then that is given for examination to find what is the positive agent. Okay, so these are the tests required. And upper respiratory infections are contagious. They can pass from one person to other person using either droplets, direct contact, under indirect contact. Sneezing or coughing, if you don't cover your nose and mouth while you sneeze or cough, you can spray the germs into the air. People can breathe it. Sneezing or coughing into somebody's hand, or and then you touch that hand, somebody's coughing into their hand and they don't wash it, they don't sanitize it, and they shake hand with you, you will also get the infection. So signs and symptoms of respiratory infection: cough, fever, hoarse voice, your voice changes when you are suffering from cold or any respiratory infection. If it has affected your larynx, obviously your voice will change. Fatigue, lack of energy, red eyes, runny nose, stuffed nose, sore throat, lymph nodes around your neck, under your jaw is swollen. When doctors do the physical examination, they can feel the lymph nodes under your jaw. Okay, it means the lymph nodes are swollen, means the lymph nodes are hyperactive. And the lymph nodes are hyperactive when you're dealing with any infection. Okay. How long does the respiratory infections last? Just maximum, it will be 1 or 2 weeks. Usually, if it is a common cold, it will go away on their own within 2 days. Okay. Some medications you can take just to relieve the symptoms. You have to drink a lot of fluid to stay hydrated. Okay. And if your symptoms are not subsiding between these 2 weeks, you have to get your checkup done. You have to get further diagnosis done. It could be pneumonia or bronchitis. The use of antibiotics in upper respiratory tract infection, only and only if it is a bacterial infection. We have diagnosed it, we have proof that it is a bacterial infection, only then antibiotics should be used. Do not abuse antibiotics for viral infection. Okay, if it is a viral infection, antiviral or vaccinations will be prescribed. Okay, apart from that, only if it is a bacterial infection, antibiotics should be used. Okay, short acting antibiotics, short term antibiotics should be used, not long term. And most of the time it is viruses which cause respiratory infection, for which you don't require any antibiotic. Okay, you just have to take some painkillers, some antipyretics which can bring down your fever. Drink a lot of liquid fluids. Okay, rest well, keep yourself warm. If it is a sore throat, don't talk too much, give your throat a rest. Especially if it is a streptococcal infection, which is common throat infection. Okay. Most of the throat infections that occur are streptococcal infection. In that case, antibiotics can help. Penicillin, amoxicillin can help. So antibiotics should not be prescribed for common cold. Common cold, that is very frequent. The causative agent is rhinovirus. Okay. It's not a bacteria that causes common cold. It's a virus that causes common cold. Okay, that is rhinovirus. So antibiotics should not be prescribed. And only if there is some specific bacterial infection along with viral infection, okay, if both pathogens are present, then antibiotics can be prescribed. Streptococcal pharyngitis, otitis media, bronchitis, okay, if these are bacterial in nature, then antibiotics can work. If you unnecessarily prescribe antibiotic, the patient may suffer from antibiotic resistance, which means the bacteria has learned to overcome and overpower antibiotics, and antibiotics no longer work on them. So that is antibiotic resistance. Am I audible to all? So if you have any of these symptoms, you have to contact your healthcare provider. If respiratory infection is causing any of these following symptoms, you need a medical emergency visit. Okay. Am I audible to all? So if there is loss of consciousness, if there is a fever more than 103 Fahrenheit, rapid breathing, difficulty in breathing, okay, if these are the symptoms, frequently you're coughing severely, and sometimes blood may be seen in that sputum, okay, and high pitched wheezing sound. Wheezing, as I mentioned earlier, it's a whistling sound, like a whistle has a whistle have been stuck in your throat. Okay, it's a very shrill sound when you breathe out. That is wheezing. Okay, so that's a sign that your trachea and your bronchi are because the air passage in them, airway passage in them is getting smaller and smaller. Wheezing is an indicator for that. Okay, dizziness, then retractions is if the person suffering from this respiratory infection, okay, they have removed their upper clothing, okay, and when they are breathing in, you see the outline of their rib cage, even from their collarbone, just below their collarbone. And if their collarbone is also very much visible when they are breathing in, okay, that is what we call as retraction. Okay, and it is more commonly seen in children who have breathing difficulties. Then stridor, it's that harsh, raspy, vibrating sound when you breathe. Okay, which sounds like a seal sound. And it is more common in children than in adults. It's not a high pitched sound. Okay, there is a vibratory sound in the breathing. Sputum test is done. To differentiate if it is viral or bacterial, you have to give a nasal swab test or sputum test is done. Only the laboratory can diagnose it. Okay, you have to give your swab specimens or sputum specimen for microbiological findings. The nutritional considerations, diet is significant for immunity. If macros and micros should be balanced because that are important for your immunity. And if you're deficient in macros and micros, you are at the risk of upper respiratory infection. And also the duration. Okay, if you have a lot of deficiency, even to come out of a common cold, it may take you time. A normal person may suffer from the signs and symptoms of common cold for just 2 days. A person who is malnourished or deficient, okay, they may suffer from the symptoms for 4 to 5 days. Okay, so the duration also matters. Zinc, zinc can inhibit rhinovirus. Rhinovirus is the common cold virus. Okay, and also it can help in the prevention of viral replication. How does virus infect you? Virus get inside your body and they create copies of themselves using your DNA and RNA synthesis method. That is how you get a viral infection. So if you can prevent these copies, okay, prevent the virus from making more and more copies of themselves, you can control the viral infection. So zinc plays into this mechanism. Okay. So zinc lozenges that are supplements can reduce the duration of cold by nearly 3 days. Okay, a study was done. So that in that study it was found that zinc lozenge, it is zinc supplements can reduce the duration of common cold by 42%. Then fatty acids, supplementation of omega-3 fatty acid can also reduce the incidence rate of respiratory tract infection in infants and even in children. Infant and children who are not deficient in omega-3 fatty acids, they have more resistance towards upper respiratory tract infections. Then vitamin D supplementation, again, certain studies have found that vitamin D supplements can significantly reduce the occurrence of upper respiratory tract infection. That is 4,000 to 10,000 international units per day of vitamin D supplement. Okay. Vitamin C, prevention and treating of cold, it is widely accepted. Okay, even during the COVID times, vitamin C supplementation and zinc supplementation were pushed forward. Okay. And usually, so the studies have mentioned that high doses of vitamin C is given for upper respiratory infection only for individuals who are in a specific environment, okay, who will be in a very stressful environment, like people who are marathon runners, skiers, soldiers, who are exposed to severe cold for a long period of time. Okay, not that you're traveling through during your vacation, you're traveling and coming back, not like that. It's being in such severe environment and in a severe stressful environment is a way of life, okay, for certain people. In those people, mega doses of vitamin C has shown to reduce the incidence of upper respiratory tract infections. So that's about respiratory tract infections. If you have any queries, you can mention in the chat